So now I am demonstrating intradermal stitches. So now where exactly the need of intradermal stitch is. So intradermal stitch is actually we are taking by non-absorbable stitches, and that is buried suture that we put inside the wound. Now putting inside the wound will give strength to the tissue. So while we remove the cutaneous stitches, the intradermal stitches are still there and giving strength to the wound. So it will not allow the wound to get separated, holding the tissue for the longer time, so that the linear scar post operatively will not happen on the surface. So this is a basic principle of putting intradermal stitches to hold the tissue. So the placement of intradermal stitch is in the lower part of the dermis. So I am holding the margin, taking it laterally so that I can see the lateral wall. Now giving a prick on the lateral wall, maybe 4 millimeter of the volume in the lower part of the dermis. So if we can see, this is the surface, this is lateral wall, and this is the bite taken in the lateral wall of the wound, and the volume of the bite is almost 4 millimeter, and the depth from the surface is 2.5 to 3 millimeter from the surface. So taking the needle out, and in the same volume and same depth from the surface, I will be taking the bite on opposite side of the wound. So holding the left side of the wound margin, taking the bite at the same level and same volume, and this is the exit of the needle. Now taking the full length of the thread out and giving the closure. So 1, 2 and 3 loops are given, holding the second end of the suture material and pulling the thread to give the closure. Then second knot, then third knot and fourth knot. So while we cut the thread, we have to look for, we are cutting from the last knot itself. So if you analyze the surface after giving intradermal stitches, now we can see the margin is exactly in apposition. We cannot see the end of the thread outside the surface because we cut the end of thread just near to the last knot given to the suturing technique, and the surface is closed as well as there is no wound visible here, and margin is in apposition. So these all are the characteristic of the intradermal stitches, and if we see inside the wound, there is, we can see the end of the suture, but the wound cavity is not there. So these all are the characteristic of your intradermal stitches. So we have to give consecutive 1, 2, 3, 4 in a sequence to give the closure of the wound, so that on the surface as well as inside the wound there is no space left inside the wound. And after completion of this intradermal stitches, we are going to do the vertical matrix stitches on the surface.